Good morning, everyone. Happy Friday, April 5th. Jennifer and Wendy filling in for McGraw. Good morning, Wendy.
Hello.
And good morning, Zach.
Good morning.
I know, this is the end of your morning. Well, we want to get started right away here with Dr. Joe Ojile from the Clayton Sleep Institute, because we all need a good night's sleep. Good morning, Dr. Joe.
Good morning, Jennifer, and good morning, Wendy. And I thought maybe you guys overslept.
No, we did not.
No,
but
we wish.
We will get to details about the Clayton Sleep Institute and how you at home can get help. But first, I want to ask you this. How do you define great sleep?
So great sleep is when, first of all, you have a good, stable sleep pattern and you feel refreshed and good in the morning and throughout the day. I think that's a nice, easy definition.
Many of us know about challenges with sleep. Do you believe in circadian rhythms and the fact that some of us are born as morning people or extreme morning people, and some people are just naturally night owls? They're not lazy. They're just night owls.
Yeah, I think the data is quite clear that your statement's spot on. We all have our own circadian rhythm that we're born with, and some people are owls and some people are larks. And so, there's a good chance that, individuals who work the morning shift at radio stations and those of us that get up early to take care of patients have lark physiology. And sometimes folks who work in the evenings or overnight have tendencies to have owl or night owl type physiology. So I think there's clear data that's a fact in today's world. So I appreciate that question. It's an important one.
Dr. Joe, can a lark become an owl, or can an owl become a lark?
Yeah, so we can frequently help people adapt to new physiologies or new sleep patterns. Converting someone to a different physiology would be a much more controversial question, and I think that we'd have to say that would be a difficult proposition. But certainly adaptation are measures. If you have to work an early morning shift and you have night owl physiology, we usually can do some things to help people adapt to that. But actually changing their underlying physiology is quite difficult, and so we don't typically see that.
I want to tell everyone the Country Club Car Wash text line is open at 84126 in case you have questions for Dr. Joe Ojile from the Clayton Sleep Institute. So on that question that Wendy had, let's talk about quality and quantity and regularity and timing. There are many people, for example, who work regular hours. How important is it for them to have regular sleep at the same time? Because I often hear people say, I'll sleep when I'm dead. I'm sure maybe you haven't heard that since you're helping people with problems.
Yeah. That was a common refrain, and we had people who said that even, in our younger days. So a couple things. One, that attitude of sleeping when you're dead will, in many studies would suggest it's going to enhance that outcome. And so sleep regularity is really the key thing. And you've hit upon the two really big issues, right? Having enough sleep opportunity, and your brain likes consistency and regularity. So we all are born, just like the circadian rhythm you mentioned, we're born with a certain amount of sleep that we need per hour to function correctly. That's when our parents, and the good Lord made us, that's whatever we got. The average of that for most of us is about 7 hours and 45 minutes. And there's a geometric spread, just like grades in school, of how much sleep we need. But we'll operate on that. So that means that we need to try to have a sleep opportunity of about 7.5 to 8 hours a night. And we want to fix that. Most importantly, the wake time, as you all have become well aware over the years. And if you can get up at the same time each morning and get some bright light for 15 or 20 minutes to help secure, that bright light secures your bedtime, believe it or not. We have a little gland in our brain that feeds off light. And so get up then and have a bedtime that's about 8 hours before that. So if we do those things, a lot of good things happen as far as our overall health. And actually our fitness level helps people train and help people function during the day. So I don't mean to be too windy, so I'll be quiet at that point.
Dr. Joe Ojile of the Clayton Sleep Institute is our guest. If you're just joining us during this hour, the last hour of the McGraw Show, the Country Club Car Wash text line is 84126. And Speaking of that rhythm, Dr. Joe, you've heard people also say, I'll catch up on my sleep later. Is that something we should count on, or is that also kind of a misrepresentation of reality?
It is. There is a little bit, just a sliver of truth that if you have in a sort of one night here or there, that's an aberrant thing. You're out very late for a big event or something. You should still try to stay in your pattern, but you may benefit from a very brief nap the next day, but it's really better just to stay in your pattern and not do a catch-up type thing. For folks who sleep deprive themselves constantly and then regularly try to catch up on the weekend, that can lead to some bad habits and is not as refreshing because your brain, again, likes that consistency. This is a bigger issue for people so if that's a selective thing, in other words, people doing that as just sort of a habit rather than a necessity, we would certainly advise against that behavior. Now, if you work a job, say you work overnight and you're constantly sleep deprived, then there are some strategies that will try to help people build out to increase the total amount of sleep they get, both in 24 hours, but also over the course of the week. Those are, we ask people in our society, some of them to work nights and do jobs that have to be done. And sometimes we have to help them adapt to that. It's a tough job.
Dr. Ojile, when were you in medical school and when did you do your internships and what was your sleep like?
Man, you're asking hard questions. I don't know if I can divulge such personal information. So this is the 40th graduating year of our class. I was really fortunate to go to St. Louis University School of Medicine, graduating in 1984. So to my great classmates out there. And I was fortunate in both undergraduate and medical school and whatnot training, except when we worked nights. I always had, without knowledge of what I was going to do in the future, really great and consistent sleep patterns, getting to bed at about 10:30, maybe a little bit later, and then getting up, 6:30 or 7 every morning. So those have been sustained over the course of my fortunate life. I was really had the good fortune of being in a great we had a Department of Internal Medicine at St. Louis University, and our pulmonary department there where I trained, we had one of the real early pioneers in sleep medicine. And I was able to work with him during those early days before he left and became the head of the sleep department at the Mayo Clinic. So that began our journey on sleep medicine and research. So I feel very thankful about that. Thanks for asking.
Before your medical career, did you have an interest in it? Were you one of those people who just found it fascinating? Because it is kind of a fascinating field of study.
It is. I can't declare, Wendy, any interest prior to that. But once I got into training and was exposed to what was going on, and these were the early days of sleep apnea therapy, just the very earliest days, and also more and more interest in insomnia and some of the early sleep aids that were coming out. It became very fascinating and to me. And again, when you have a mentor in a department that nurtures that sort of interest, it just explodes from there. And so it's been a lot of fun to be able to do this, and also to help in a small way create interest in our St. Louis area and region where I've been fortunate to live.
Dr. Ojile, can sleep deprivation affect fertility in young people hormonally?
So what we do know is that we've seen people that have severe, for instance, obstructive sleep apnea. In the most extreme cases, it can affect miscarriages and things like that. Certainly, extreme sleep deprivation can affect hormonal control. I don't know the data particularly on sleep deprivation and fertility, but I think your question as a hypothesis is an interesting one, and I suspect there's fertility doctors who have looked into that more closely. But on the surface, I would have to say I suspect it does. And I don't think I've ever been asked that question before, but I think it's an incredibly timely question given the issues with fertility and pregnancy that we see going around in young people as they're trying to start their families.
And what does it mean when people say they're tired but wired? I mean, they want to go to sleep. They've been up too long. And you see this in newsrooms, for example, a lot.
So usually what that is, unless they're really doing a lot of hypercaffeination, is to your original statement that you made about circadian rhythm. What happens is their circadian rhythm is on the upswing at that point. So they haven't slept in a long period of time, and they were tired. And so what happens, the circadian rhythm starts to swing up. And so they get a burst of arousal, of brain arousal or energy from that circadian rhythm. So even though their body is tired and fatigued, their circadian rhythm is increasing their level of alertness to the point where they struggle to go to sleep. So the best example of that is like if you fly from here to Europe and it gets to be, bedtime in Europe, but here in the U.S. it's dinner time, right? It's late afternoon or dinner time. And so it's difficult to go to bed at the European bedtime the first day or two. So that's what they're really describing as a form of social or work jet lag.
Dr. Ojile, we will take a break here, and when we come back, the questions are rolling in on the Country Club text line. And I just want to tell all of you at home that Dr. Ojile is the head of the Clayton Sleep Institute. If you want to go online right now as you listen to us, just go to ClaytonSleep.com. And Dr. Joe, if you can hang on, we have lots of questions for you from our listeners.
And we're probably going to start with a question about magnesium supplements, and I know you're hearing a lot about that, so just a little forewarning. Dr. Joe Ojile of the Clayton Sleep Institute is our special guest this hour on the McGraw Show. The Country Club Car Wash text line, 84126. The magnesium supplements, Dr. Joe, in terms of the oil on the bottom of the feet, taking the capsules, it's all over the place. Is there anything to it, or is it just a sort of one of those conventions of social media?
There are studies looking at magnesium supplementation in, for instance, elderly folks, with the theory that this improves as people age. They take in less of magnesium, which is needed for conductivity in the cells, especially in the brain. There's at least one study that does show some benefit taking magnesium supplementation with some of the sleep parameters and perception of sleep. So, and I think if it's a risk-benefit type situation, taking, the normal magnesium supplementation you would buy at a pharmacy and whatnot without a prescription is reasonable. I would not suggest these high-dose regimens that people discuss, but taking some steady magnesium supplementation does appear to have some potential benefit for folks in some of the studies. So I don't think it's outlandish or unreasonable to use it. And of course, the downside to it's quite limited. So things that like this, I think it's a reasonable thing to consider. I wouldn't consider it, a silver bullet or a magic trick that's going to help everybody immediately. But some of these more narrow things like this can be quite helpful for some people.
Dr. Ojile, I know that sleep apnea can be life-threatening for some people, and we have a question on our Country Club Car Wash text line. Can you ask Dr. Joe what he thinks about Inspire, the implant for sleep apnea? I've never heard of that.
So the Inspire technology is another way we call that airway management. However, we keep the airway open because sleep apnea is the airway collapsing when you're trying to breathe at night. So it's not considered first-line therapy. So it's an implanted, basically a type of pacemaker they put under your clavicle typically, and they put wires up to the back in the neck and then one on the chest. And it coordinates your airway opening up while you're breathing at night. So people that have more severe apnea who meet certain criteria, including failing primary therapy like CPAP, may be considered for this therapy. So we do have people that use it, a few people, and so it is something, but it does require surgical intervention and whatnot. So it needs to be considered in the proper context of overall sleep apnea therapy. But it is an interesting therapy that can be effective in some people.
Is the more typical therapy a CPAP? And can you go into that? Because I know at the Clayton Sleep Institute, you also do something you call CPAP reassessment.
Yeah, so what we do, first of all, again, it's all about keeping that airway open. So the two most common therapies you see today are the positive airway pressure, which is what PAP stands for. And so that still remains the standard therapy for most people. Also, dental appliances made by sleep dentists, which we will frequently collaborate with and send patients to pull the jaw forward and open up, keep the back of the throat open. So the whole goal here is to keep the back of the throat open while the patient's sleeping so that they can just breathe on their own, which is what they're trying to do. And so that would remain still the two most common therapies for most folks with obstructive sleep apnea. And, of course, the damage for people with obstructive sleep apnea that's untreated, especially the more severe cases, are the risks going forward of either recurrent stroke or heart disease, or the risk of developing heart disease, stroke, and then all the downstream sequelae of, not being awake, driving a motor vehicle or making decisions when you're sleep deprived chronically, other things like hormonal changes in people with thyroid disease or testosterone illness, that sort of thing. So there's quite a few downstream problems with untreated apnea.
Dr. Joe Ojile of the Clayton Sleep Institute is our guest. The website, claytonsleep.com. The Country Club Car Wash text line is 84126. Do we overuse the word insomnia, Dr. Joe? Do we really have a solid understanding or a grip of what insomnia actually is, scientifically speaking?
Yeah, so we do. The definition we have is that it's inability to get to sleep, stay asleep, or lack of refreshing sleep in the morning. So it has to have with a daytime consequence. So if you're a person who your biology, like we talked about earlier, you don't require 7.5 hours sleep, you only require 6.5 hours sleep, then you don't have insomnia because they don't feel tired during the day. So we have to have that conversation. So we do have some, very solid definition. We have to go through that with the patient and study their sleep patterns. And it is quite common in study after study. It's between 9 and 11% of the general population of the United States suffer from chronic insomnia. So that's a very large population of folks who have these issues. Many times we can fix them with just behavioral intervention. Most of the patients do not need medication. Some do. There's special populations of folks that either they have what we call primary insomnia, where they just biologically have trouble with their sleep initiation or sleep maintenance, we call that. And then people that have had other things happen to them in life, like one of the most common things we see are people that have had traumatic events, so post-traumatic stress disorders from a variety of things. They've been in battle. They've been injured in some way in life. They've had some sort of traumatic event. They need extra intervention because their biology is such that their hormones that control activation or arousal at bedtime seem to spike up as they go to bed. So there are good definitions, and it's a population in our country that is seeking help, and so we're trying to offer better solutions.
Dr. Joe Ojile is the head of the Clayton Sleep Institute. And on the Country Club Car Wash text line, Dr. Ojile, somebody is asking, how do you get your brain to turn off when you lay down? And what does happen to our brain when we sleep?
So two questions. The first one, so we find out from folks what's going on as they go to bed. But sleep's something that you enter, not something you do. So this question is excellent because it's about letting your brain calm so you can just enter sleep. And we do have different techniques that we teach people. We always tell folks, your mom and your grandma knew a lot. And so it's setting down the troubles of the day. First of all, getting off, if you can, all your electronics about 2 hours before bedtime. So getting off your phone, your email, your computers, so letting your brain settle down that way. Many people need some wind down time just to allow their brain to actually settle. I mean, that is the right approach. In some people, if their brains are a little active, we'll have them journal. We call it a worry journal. Write down all the things they're worried about, they're concerned about. They don't need to show it to anyone. They don't need to save it. It's the act of writing that down and giving all your issues or your things tomorrow. People sometimes get focused on, I got to remember to go to the grocery store and do this, or go talk to so-and-so about something. Write all those things down so you can be liberated or freed of those concerns as you're going to sleep. Those are just a few very general things that will work with people to try to get them to wind down. And again, to your earlier comments, the stability of your sleep patterns are also key to this, so that your brain starts to naturally wind down because you know that it's getting to be time for bedtime. My bedtime's at 10:30, so you know that your brain will start to quiet on its own a bit because it knows that you're going to get in bed every night at 10:30. So those are just a few general observations. And then what was the second part of the question again? I'm so sorry, Jennifer.
What happens to our brain when we sleep?
I'm sorry.
I mean, it doesn't become inactive, does it?
And
it sure doesn't.
And Dr. Joe, is everything you just outlined, is that called sleep hygiene?
That is a big part of sleep hygiene. Yes.
Okay.
Not all of it, but a big part of it. Yes. And that's one of the most, common things we work with folks on, because in the way our world is today, everybody's busy, they're active, there's so much engagement in a variety of channels that we need. The sleep hygiene issues and some of the other things we talked about, the behavioral therapies, are really quite important. Your brain is active. 100 years ago, the idea was the only thing we knew about sleep is that you weren't awake. It was just this sort of vague, and nobody knew. So over the time, especially in the mid-1930s, late 1930s, sort of the first EEG with sleep was being done, and some of these sorts of things. They found out there was a lot of activity. What we know now is during sleep, about every 90 minutes or so, you cycle through all the stages of sleep, there's 4, and then you go into REM sleep, rapid eye movement sleep, where you are paralyzed except for your eyes and your breathing muscles. You do that about every 90 minutes or so, or 100 minutes as an adult. So that's one. Your brain, as you said, is quite active. Many of the other the systems in your body are calming. So your heart rate typically slows, your respiratory rate typically slows, but your brain is cycling and it's processing. And we know now over time the processing includes things like memory. So there's actually information that, again, getting the right amount of sleep, going to bed at the same time. If you want to remember things, for instance, if you're a student studying, it appears that it's better to get the right amount of sleep, work up until closer to your bedtime, and you'll have better memory consolidation by doing it that way. So we don't exactly understand how all that works yet. The brain's still a mysterious thing. It also is a time when we clearly dream, whether we remember it or not. There's a new book that's been released in the last several months called Why Brains Dream. It is an excellent book. If any of your listeners have an interest in this, it's written in such a way that you can be a scientist or just a person with an interest in health, and I think really enjoy it. There's a lot of great information in there about some of the activities of the brain. So to your very point, it is a very dynamic and active time of our lives that we're only beginning to understand. A third of our lives that we're only really beginning to understand.
We have many more questions for you. We'll take a break here. When we come back, we'll continue our conversation with Dr. Joe Ojile from the Clayton Sleep Institute. You can go to claytonsleep.com for more information. We will get to more of your questions in just a moment. We're chatting with Dr. Joe Ojile from the Clayton Sleep Institute. He just recommended a book called Why Brains Dream, released in the past few months. You might want to check that out. And the Country Club Car Wash text line is open. Dr. Joe, somebody said, I only feel good if I get 9 to 10 hours of sleep. Is there something wrong with me?
So I would say if that's been a consistent finding for them, then there's nothing wrong with them, typically. They just may be, if you think about the spread, like of grades, like A, B, C, D, that what we see, the peak average is about 7 hours, 40 minutes, but there are long sleepers, people who need over 8 or 9 hours sleep a night. And that is their biology. So part of it is understanding and embracing that. And if they feel good with that and they can do it, there's probably nothing wrong with them at all. And in fact, congratulations on understanding and seeing that issue with your own biology.
What do you think about long-term use of Ambien, Zolpidem, and somebody's asking about using gummies every night with CBD or THC.
And melatonin has been mentioned a couple times too.
Okay, so let's kind of go through them, sort of systematically. Melatonin is a naturally occurring hormone. It's the hormone that spikes up as you go to sleep, which is one of the reasons you get jet lag, by the way, because your brain can't move the melatonin secretion that rapidly when you go over multiple time zones quickly. Some people do use melatonin. Melatonin can be used for more than just sleep, as far as this question. But in the use of this, first of all, using melatonin, you need to use it about 90 minutes before you go to bed. It's not necessarily a sleeping pill. It doesn't make you go to sleep per se. It can be effective to help some people with their consistency and sleep initiation and maintenance. We don't routinely tell people to use it just if they're having trouble to sleep, and it will not substitute for good sleep habits and whatnot. So it may in some people be an adjunct. We do use it in other settings for other sort of sleep disorders, and a little bit beyond this question. I don't think there's enough time to go into that. The other thing is low-dose melatonin is always suggest people using for a regular sleep pattern, 1 to 3 milligrams per se. Maybe if they can only get the 5 milligram tablets at their store, that's fine. There does not appear in this situation to be benefit to the high dose melatonin. So we want to tell people to kind of avoid that, just because we want to avoid any potential downstream side effects, even if they're theoretical. On the gummies, the question from a perspective of where we are as a sleep society and research society around the country, there currently is not enough evidence to recommend that to folks for sleep in a general way. So we avoid kind of weighing in on that issue right now. That's the official standing, actually, of our academy as it relates to that. On the other common sleep aids, we want to make sure that when we're using these sleep aids, it's done in the context of their overall sleep behaviors and sleep health. There has been study of them over the course of a year. If used correctly and properly and observed over time, while we prefer to have people on as few medications for the long term as possible, there are some small percentage of people that will need long-term assistance under doctor supervision with drugs like this. And again, I mentioned people that have PTSD or other underlying anxiety or sleep disorders that we have to have the holistic view of the patient involved. So again, done under supervision with your doctor, or in consultation with a sleep doctor, these drugs can be used properly and correctly over the long term, but it's not the majority of our patients.
Why do we talk in our sleep?
So you must have just been waiting to ask that question.
Well, Wendy and I have had this conversation, and I've talked in my sleep my entire life.
So have I.
So, well, the key is to record it and find out. Maybe you're going to tell us some secrets that are.
I don't remember what I said.
So, some people talking in their sleep is just a normal part of their biology, and frequently you'll find out that their parents, one or both of their parents, may have talked in their sleep, or their siblings talked in their sleep. It can occur during either what we call delta, that's slow wave sleep stages, and that's referring to the patient's brain waves. That's stages 3 and 4. They'll kind of mumble, or if they have a little bit of activation during REM sleep when they're supposed to be paralyzed, people can sometimes talk during that time. For most people, this can be a normal variant. In a few people or some people, it can show up as they start to have other disorders where there's a syndrome called REM behavior disorder, where they start acting out their dreams later in life. You can start to see it with that. You sometimes can see it in folks, especially young people, when they get these, we call them confusional arousals during slow wave sleep, where they'll mutter things that are somewhat nonsensical. For instance, if you wake them up on the couch when they've been sleeping for a little while and try to walk them to their bedroom, young people, children, and young adults they have a lot of what we call stage 3 and 4 sleep. And if you wake them, they're confused. If you think about, most of us have had that experience. And because they're in this deep kind of sleep, and they'll mutter things, but it doesn't make any sense. But during REM sleep, if you get woken up, you can speak, sometimes have an intelligent conversation, and not remember it at all in the morning. So, and there's nothing in a sense wrong with you. It's not that you have a problem. So there's lots of stories we can go into about that, but I think it's beyond the scope of our discussion today.
Yes, and we need to take a break here. When we come back, we'll tell you how you can connect with the Clayton Sleep Institute and get help if you need it. Back in a moment. We're chatting with Dr. Joe Ojile of the Clayton Sleep Institute. Its new location on Tesson Ferry Road in South County. Dr. Ojile, if we have listeners who want help, and I know you do sleep studies there at the Clayton Institute and also at-home sleep studies, what do they have to do?
So if they have an order for a sleep study and they want to have that done through us, they can contact us at 314-645-5855. That's a sleep laboratory. If they'd like a consultation with myself from our Dr. Jeff Harris, 314-849-1500 is our office, and they can arrange a consultation, and we can see if they indeed need a study or if they need an evaluation. Not everyone who has a sleep problem needs a sleep study. And in fact, I think people are quite surprised at how many different things we will work with patients who don't actually need a sleep study. They need really things like sleep diaries and intervention on their sleep behaviors, or they need a medication for things like restless leg and other symptoms. So in any case, that's a good way to get started, and we'd be certainly honored to try to help.
What ages do you treat?
We really from over 17 on up, but most of our patients are about 22 years and up, all the way up to as high as 95 years old.
This is such an exciting time for you. Jennifer and I visited the campus, and we can't wait to hear more about it in the weeks and months ahead, Dr. Joe.
Thank you very much. We were really very honored that you came and spent some time touring the new campus we've just opened up, and we want to just do our best to bring the best of sleep care to St. Louis. We've got a great sleep community here, and we're really happy to be a part of that.
We just wanted to take a nap because...
Well, and Dr. Joe, we just have about a minute left, but we have had a couple of questions from people who ask if it's possible to sleep too much. Somebody said they get 8 to 9 hours, or they know someone who gets 8 to 9 hours of sleep a night and then naps for 3 hours.
So, I think the issue, what they're talking about are people that are spending too much time in bed. And sometimes we have to be really careful how we comment on those things. People can be getting too much sleep in the sense that they have things like depression. So other underlying illnesses can provoke that. And they may not be long sleepers, or if they just need that amount of sleep, we need to chart it out. But if their sleep patterns are very erratic, their sleep can be broken up like that. So that should be discussed and looked at. But there can be a problem in some people with that. So we don't want to say it's a problem just out of hand, but certainly having a conversation and evaluating it should be considered, because that what they're describing there sounds like that sleep pattern is impacting their life.
Mm-hmm. Nothing like a good night's sleep. Dr. Joe Ojile from the Clayton Sleep Institute. You can call 314-645-5855 or go online to claytonsleep.com. You'll be hearing more about the Clayton Sleep Institute on the Jennifer and Wendy Show. Dr. Joe Ojile, thank you for joining us.
Thanks,
and have
Dr.
a wonderful
Joe.
weekend. Sleep well.
Thank you both. Have a great weekend.